Hello, everyone. My name is
Hi.
Faith. I'm a broadcast reporter for Cronkite News on Arizona PBS, and I'm currently working on a story. I don't know if Angel's told you a little bit about it, but I'm working on a story that's talking about mental health during this whole COVID-19 crisis. And as you guys know, it's already a problem in Arizona in general. So I just want to find out how it's gotten worse or gotten better over time. I'm hoping you guys can tell me and let me know and tell me a little bit more about what you guys do. But that's just a little bit about me. If everyone wants to go through and do just like a quick introduction of who you are and what your job is in this whole process.
So I'll start. I'm Mitzi Crockover. I'm an internist, so it's MD. I'm not practicing clinically, but I am the president of the board of Institute for Mental Health Research.
Awesome.
Okay, well, I'll go. I'm Keith Cernick. I am a clinical psychologist and also the chief scientific officer for the Institute.
Hi, Faith. I'm Mike Meyer. I'm one of the co-founders of the Institute and president of Meyer Consulting.
Awesome.
Hi, I'm Athena Actipis. I'm a professor at ASU and I study cooperation and interdependence and health. And I've been doing a project looking actually at changes over time since the beginning of COVID. So I'm a researcher that's been generously funded by IMHR.
That's amazing. Thank you.
And Athena just also received what we call a micro grant from IMHR for her research as part of our COVID-19 Impact Fund.
Yeah, that's amazing. I'm hoping to hear a little bit more about that. But can one of you first start off by telling me what the Institute for Mental Health Research does and what it is, and why you guys are granting these funds to specific researchers?
Mike, you want to take that one?
Sure. So Faith, the Institute for Mental Health Research started 20 years ago, roughly, as a public-private partnership. It was there was a piece of legislation introduced into in the Arizona legislature that passed both the House and the Senate, was signed into law by Governor Hull, that created the Institute for Mental Health Research. And at that time, which is 20 years ago, the state put in several $1 million in funding, the requirement being that it was matched by private dollars. It was matched by private dollars. And then over the next 20 years, there hasn't been any additional state funding. It was really seed funding to get the Institute going. And over the next 20 years, we funded, I don't know, Keith would have the numbers, but somewhere in the range of probably 40 or 50, maybe as much as 60 scientists here in the state of Arizona. We've given out, probably, I don't know, $2, $3, $4 million. And today we continue to fund researchers like Athena. And the goal of the Institute is really to support Arizona researchers, especially younger researchers, through seed grants so that they can have the resources they need to generate additional funds and additional major grants from the National Institutes of Health and other foundations, which of course brings dollars into the state, keeps people like Athena here in the state, not going to other great universities. And then in addition, we put on educational programs. So those are the two things, Faith, that we do. I think Dr. Brockover and Dr. Cernick will talk about this in a minute, but I don't think it comes as a surprise to you in a pandemic that this whole area has become even more important. It was critically important before, but the topic and the importance of the research has become even more important.
Yes, exactly. And then can you explain to me what exactly the COVID-19 Impact Fund is, and how this one is a little bit more specific since there is a pandemic going on? What exactly is that fund?
Sure, I'll take that one. So when I think that there's been increasing number of articles and focus on the fact that not only are we seeing the physical effects of COVID-19, but we're seeing the mental health effects of it. And someone was quoted as saying, it's a coming tsunami. And so what we wanted to do was try to get in there, early so that we could fund this early research. Because what we know about COVID-19 is that there's four main areas. One, we're already seeing from the trauma and the stress that our first responders, our healthcare workers, and our essential workers are dealing with because of the volume and just the intensity of what they're dealing with. Second is the social isolation that focuses, I think everybody feels it certainly, but we're also significantly concerned about the effects of our youngest, our children, as well as as the elderly and those that are shut in, if you will. The third is the fact that we already have had a number of people that are struggling with mental illness already, and this only exacerbates it. And the fourth is something that is brand new, and that we don't know how the COVID-19 virus is going to actually affect the neurological system. So we fund research in all of those areas, whether it be behavioral or neuroscience. And so what we wanted to do was shine a light on that and focus our funding on those researchers that are focusing on COVID-19 and its effects on mental health.
Yeah, thank you for sharing that. That's amazing that you guys created this specific fund. I've been super interested in it. Mental health is something I'm super interested in and passionate about. And it's just crazy how Arizona is continuously in the top numbers pre-pandemic and during the pandemic. So can you tell me a little bit more about what conducting this research looks like and how that process goes?
That one's a Keith question.
Well, of course, what our job really is to identify the researchers who are out there doing really innovative, creative kind of work. You'll get a chance to talk to Dr. Aktipis about what she does, and she's one of those individuals that really does this amazing level work. And it's our job to really identify those folks and get them a little bit of funding to help them do this new level of research that we're hoping moves them forward to be able to write larger grants that are going to bring more research to the state and more answers, right, to the questions that we have really about how COVID is impacting. And what I think that Dr. Krockover really started to talk about was the fact that there's important levels to think about here for the people that actually contract the disorder, the disease, right? That's one level of health effect, right? And that has a significant mental health component. But all of us who are just exposed to these pandemic issues, and I think this is where Athena's work is going to be really critical in helping us understand what's happening around the mental health processes of behavior of humans during pandemic kinds of times, right? And how that affects our well-being as well. So it's our job to try to identify who's doing the most important creative work that's going to provide us some answers. Because the only way that we can really make an impact is to generate the evidence that things are true. Okay, we can't just make it up or think we know it because of past kinds of illnesses that we've dealt with. We have to study this, and we have to identify what the reality is in these projects so that we know what's real, what works, what are the facts behind the mental health concerns here. So that's what we're hoping to do by identifying these folks and providing money to them so that they can do the work that then leads to bigger questions and more answers for us.
So what are the answers that you guys have found from this research?
Well, I would say we haven't got there yet, Faith, okay? But that's kind of where, I mean, this has come on really quick, right? What are we, in month 6 or 7 of the pandemic kind of stuff from its very inception to where we are right now. I wish research happened like that. It would be great if it did, all right? What's amazing, though, is that people are already in the middle of projects that are going to provide those answers, right? We're not still looking just to get started, right? We're trying to find those people like Dr. Aktipis, who's already studying these processes and help facilitate her to be able to get this work done, right? So I'm not sure that we have a lot of those answers yet. What we have are people working really hard to develop those, right? And the research is the key to getting those answers, right? So it's coming. And if we don't keep this up, right, we're never going to get there, right? So I think right now, I'm not sure that we have those answers. We have questions, we have ideas, and we have I think some thoughts about what those answers might be, and we're going to check out to see whether or not they can be validated.
Yeah, we have
I would,
preliminary data also. So, you know, we might not be able to make any conclusions about, okay, you know, here's exactly what's going on, here's what we should do. But we've been following people since before the pandemic started. Me and a few of my colleagues, we realized that something major was about to happen. So at the very beginning of March, before the pandemic was even declared, we put together this project, got IRB approval, started collecting data. So we've been following 500 people around the world longitudinally since before the pandemic. So we have some preliminary data, and we actually, we're trying to make that as available as possible to general audiences, even though we're still in the process of figuring out what it all means. We want to make our work as accessible as possible and really invite, you know, people to think with us about what all of this means. So
That's incredible. And you said about 500 people?
yeah, it's actually, we have two cohorts of about 500. So we started with 500 right at the beginning of March. And then around the end of March, we added a second cohort of about 500. So we're in the process right now of pulling all that data together. We have a preprint from work that we did in the first month where we actually saw some changes in interdependence, people feeling like they were actually more interdependent from before the pandemic to after, which is, I think, a, you know, potentially really positive thing, but also some decreases in people's endorsement of cooperation and helping people. So it was kind of mixed. But right now, we're starting to look at this huge data set that spans almost 6 months now, from the beginning of March until now. I don't want to hijack the conversation, but I could show you, we actually are right now putting together an interactive data visualizer, I can't say it. How do you say it? Visualizer.
Yeah.
On our website. It has part of our data. It doesn't have it all on there yet, but that way people can go on and just look at, you know, well, how are people's answers to these questions changing? How is the US look different from the rest of the world? You know, these are all things that people can just go on the website and play with our app, and then maybe get some, you know, insights just, you know, into what has happened in the world over the last 6 months.
Definitely. No, that's amazing. If you want to talk a little bit about that, I know obviously you're still in the process of conducting this research and nothing's completed because this pandemic isn't going away soon. But if you want to talk about that, that would be super interesting to me.
Yeah, sure. And if anybody wants to just check out this right now, it just has our first cohort. So it's it doesn't have everyone in it, but if you go to this website and then click on the data thing, it has the prototype of our data visualizer on there. So you can see it's not final yet, but we're trying to get it up there and make sure that everything's working. We're going to refine it a little bit more. But basically, you know, some of the things that interest me the most are that, you know, and now this is speaking from, you know, visually looking at the data, it looks like these, you know, changes in people's perception of interdependence. So these items, all of humanity and I rise and fall together. My neighborhood and I rise and fall together. Looks like there have been increases in those over time from the beginning of the pandemic to the beginning of July, which is right now where we have the data up until into this visualizer. So, and then if you kind of break down responses by age for a lot of the items, we're seeing that people who are older and seem to often be higher in their ratings of these sort of cooperation and interdependence type questions. Women also tend to be a little bit higher than men, but for many of them, actually the group that's the lowest is also like the, you know, 36 to 45, and then you'll have, you know, even younger people sort of kind of in the middle. So, you know, those are some interesting patterns in terms of the differences. Now, if we just look at, you know, what has changed over time, it really seems to me, just from the initial look, that it's, you know, these items that are really about kind of shared fate, you know, this idea of rising and falling together with either humanity or with neighborhood, that seem to be the sort of most stably increasing. But you know, I'm just speaking from looking at the patterns as opposed to doing, you know, the rigorous statistical analyses, which we're in the process of doing, but we haven't completed that phase yet. For the data for the first month, though, the data for March, we have done all those rigorous analyses, and we have a preprint up reporting them. And we did see increases in some of these measures of interdependence that, you know, we can say, yes, you know, definitely based on our statistical tests, there were changes in that direction. And another interesting piece is that if you break it down by people who have pre-existing medical conditions and people who don't, at least for that initial month, it looks like a lot of that change in that increase in feelings of interdependence may be driven by people who have pre-existing medical conditions. So, you know, if you're more vulnerable, perhaps you feel then more interdependent with humanity, with your neighborhood, because you probably are more interdependent, right? And being more vulnerable, the behavior of others around you is going to have a larger impact on your own health, you know, physical and mental. So.
Yeah, thank you.
Can I just interject very quickly? I'm sorry to interrupt. This is Angel. This is absolutely fascinating. Athena, I wonder if you might just, in one or two sentences, could you summarize for the layperson what these findings really mean for us as we move together through this pandemic?
Yeah, well, you know, I think that there's the hopeful side of it really is that by, you know, these measures of interdependence that we have, it does seem like people overall have a greater sense of shared fate with each other than before the pandemic began. But when we then get into sort of the deeper levels of looking at all of these other measures of endorsement of cooperation and helping, it gets a little bit messy. So it's not like everything good is going up, right? It's like, okay, there's some more feeling of interdependence, but the way that that actually manifests in people's behavior is a lot more complex. There's probably a lot of other factors that are influencing whether that feeling of greater interdependence actually translates into people helping each other more, into people feeling more socially connected, into, you know, all of those things. There's other intervening issues that we can't answer those questions, at least not yet, with what we've done, you know.
Got it.
I guess maybe this is the right time to step in and talk more on a macro basis as it relates to Athena and every other young scientist that's here in the state. And it goes directly to the question of research and how quickly you can move research, because we're now in an environment where we need to move this research from the bench to the bedside as quickly as possible. And you know, because you're a reporter, we're in a perfect storm right now, which we didn't prepare for. As Athena mentioned, we have a sizable population of people that have pre-existing conditions, and they're far more vulnerable. And many of those pre-existing conditions aren't being treated, or they're being delayed. We have a public health system that was vastly underfunded before this crisis hit, and you're seeing all the problems that relate to that. And then on top of that, we have a mental health research system that was vastly underfunded. If you look at the amount of money that the National Institutes of Health gives out overall, as compared to what is given out by the National Institutes of Mental Health, it's pathetic. So you've got this perfect storm of people that have pre-existing illnesses. I mean, Keith alluded to the question of also younger people, but people that have pre-existing that are dealing with mental health issues. You've got the issues of COVID that layer on top of that. You have a very weak public health system. You have social determinants of health where you have people that are wealthy that are dealing with this, but this is a non-discriminatory illness and problem. I mean, this impacts poorer people in many ways much more significantly as it does, you know, my 85-year-old mother-in-law, where we can provide a great deal of support to her. And then if you look at the scientists like Athena, who need dollars to do research and Athena's been very gracious because she hasn't told you how stretched this is in terms of what she's trying to do. It's not like, somebody has written her $100 million check, even though Athena, I know you'd love that. So part of
That's
the
coming though, right? Yeah.
right. What I'm getting
Okay.
at is that all of this is great.
Try.
Arizona, right. We have a phenomenal group of scientists, but they need to be funded. And candidly, they need to be funded quickly if we're going to take this research and get it into the field.
So ultimately, what would be your guys' goal for the end of this research path? I know you want to fund more researchers to get as much information out of this as you can. As you said, it's a very complex issue. It's not just something that happens overnight. But what is the Institute of Mental Health Research's ultimate goal at the end?
Well, our board chair, and you probably going to speak to this, Mitzi, has set a very audacious goal, but setting those goals, Faith, are really important, which is to raise $1 million to fund research in mental health as it relates to COVID. So, and that's really, I think, in the short term, what we're trying to do. But Mitzi, sorry to interrupt.
No, that's fine. I was going to say basically that unfortunately, I don't think that there's an end. But with respect to this specific impact fund, we would love to get that goal realized so that we can really put significant dollars towards finding these solutions. And not only will that impact on just, again, COVID-related challenges, but it will have many more tentacles. One of the things I wanted to also underline is that when we fund this kind of seed research, it not only impacts and certainly benefits all of us because of this research that's being done and the researchers that are doing that, but it also brings in dollars to our institutions and to our economy. And that's really important. I believe that when we looked at what we've given out at $2 million, those scientists have then come back and provided or received $20 million in outside grants because of that initial funding. And so we feel it's a relatively small investment for very big returns. And that's what we really want to impart. There's so many great organizations that are doing work in education and advocacy and treatment, but there are very few organizations like us and none any other than us in the state of Arizona that are providing funding for research. And it's that research that's going to help us move forward and get new answers and new solutions that we need. And if I could underline anything, that would be something that we would want. Saying that though, we also want to impart that information to other professionals as well as the lay public. So what we hope to do is have a conference at intervals that highlights our researchers, highlights their research, brings other researchers together to collaborate, and then also to educate the public. So when we look at what we're trying to do and how we need to do it, it comes down to funding, certainly funding for the research, but also funding and sponsorship for those educational seminars.
Thank you. So does the IMHR have researchers conducting research on these new prevention efforts? I know a lot of new efforts are digital now, whether that's over Zoom or sometimes you can meet in person. I've heard from different locations, but have you guys been conducting research on these prevention efforts and if they're working better or worse, or how has that kind of come about?
Again, because we grant our researchers. And so as you heard, Athena's doing incredible work. She'd already been doing work prior to this, and then we're hoping to keep supporting her. So it's a little bit early, but what we are doing is that we are sponsoring a series of 3 webinars. The first one being highlighting Athena's work with collaboration on September the 9th. And folks can sign up for it, it's free at imhr.org. And we're hoping to, again, make that connection about the kind of research that she's doing and how it translates into basically news you can use, if you will, for the public. Our second one, you probably have the dates, and I apologize that I don't have them off the top of my head, but we're looking at another researcher that we funded, Lonnie Chioda, who is doing research on emotions, and certainly talking about an emotional toolkit that we can all use during this time. And the third one will be Dr. Felipe Castro, who is doing work on resilience. And again, that's something, and he's been doing the research. He'll talk to us about very practical ways that we can utilize that information.
I can also
And
jump
very
in.
quickly,
Oh, go ahead.
I'm sorry, I was just going to say I can give you the dates, Faith, for those second two webinars
Okay,
if you need
perfect.
them.
Yes, that would be
Great.
great.
Yeah, I was just going to jump in and say that, because of the funding from IMHR, we're now able to, we're actually about to start another study with 500 individuals inside the United States, where we're going to be able to dig a little bit deeper into issues of social support, social contact, also quality of friendships, and in addition to that, measure people's endorsement of things like mask wearing and other health behaviors. So kind of looking at, kind of what happens at this intersection between social well-being, mental health, physical health, and, we're particularly interested in whether there's some individuals who are more vulnerable than others because of the confluence of, maybe a lack of social support, maybe more exposure, maybe, attitudes about the future, mask wearing, things like that. So we're going to be able to do a deeper dive into some of these issues that I think are, really at the heart of kind of creating this sort of landscape that either leads to more vulnerability or less vulnerability to mental health issues.
So how exactly are you tracking these individuals?
Yeah, so we're using an online platform called Prolific, which allows people basically can sign up to be part of studies through it. And for this next set of studies that we're going to be doing longitudinally with the US, we're actually going to get a representative US cohort. And that's something that the platform kind of helps to make sure that that they handle all of the issues of, regions and, the sex and socioeconomic status, so that then we'll actually be able to say something about the United States, and we'll also have the breakdown by state as well.
That's amazing. So is this like an app or a website, or what does it look like when they're going on to this?
It's a website where people answer questions, and then they get paid. It's not a lot of money, but it's a small amount of money for every time they go on and do the study. And it's going to be every month. We're going to be asking them questions, and our plan is to do it for at least a year so that we can look at how things are changing over time. And, it's not going to be the same people that we have in this, set of studies that we've already done, but we do have, I think all in all, about 100 people from the United States in this initial study that we did. So we will be able to at least have some sort of continuity of looking at some of these factors over, more than a year when all is said and done.
Got it. Thank you. And one more question about this website. What do these questions, what are they asking people?
Yeah, so some of them are asking people to rate how much they agree with this statement. All of humanity and I rise and fall together, for example. But then we also have questions like, how likely do you think it is that you'll contract COVID? We have questions about how people discount the future. So how much do you value something that might happen in the future versus something that might happen in the present? We ask questions about the number of social contacts people have. We ask about how many people you come in contact with because of work, whether you're using masks, whether you're keeping distance. So we can ask about all of these kinds of questions, and then look at how changes in people's responses relate to their vulnerabilities. So it's a really rich data set. We're just starting to scratch the surface right now of, what we can learn from it.
Yeah, I mean, since it's such a complex issue and issues, all of those specific questions, that's super interesting. Questions that I obviously wouldn't have thought of, but tracking all of that, that must be very complex for you to dig through and kind of reach this conclusion to give out to the public.
Yeah, well, I have to say we have a huge and amazing team. We have 2 graduate students in my lab. The main collaborator I have, he has 2 graduate students who are also working on it. And we have about a dozen researchers from across disciplines that are working on the project with us, including someone who's doing our data visualization. So, we're really, really lucky to have an amazing team, and the funding that we've gotten from MHR is now going to let us keep moving forward, because it was getting a little tight with the funds I had that I was using. And then when I, heard that we got this grant, I was ecstatic, because it lets us move forward also to dig deeper in the United States, which is something we were really wanting to do, because the US is unfortunately, still really in the middle of this, when a lot of other countries have kind of come out on the other side in a way, or at least they have strategies that are, able to keep things more under control than here. So there's a lot that we need to do in the United States to figure out how we're going to manage and, keep people healthy and happy and connected, and, reduce all the vulnerabilities that are there to physical and mental health problems during this time.
Definitely.
Can I just add one thing? And
Of course.
as you heard from Dr. Aktipis, it takes a village to do what she does, and great leadership like she is. And one of the things, again, that the Institute for Mental Health Research does is, again, that idea of a small investment. So it's funding research, but it's also funding experiences for graduate students, for undergraduate students and assistants. And one of the challenges I think we're going to have, because of the dearth of financing and funding for mental health research, is that we may lose a generation of scientists in this area if we don't fund them now. And that's one of the things that really propels us, I think, to do what we do.
Definitely. I agree. I think me and Angel we're talking about a little bit over this week how there's so much research money for something like cancer, which is horrible, but I don't understand why there isn't that much money for something like mental health, when a lot of people are struggling with it and they don't even know it. So I do think it's something that should be paid more attention to, especially now with everything going on. I mean, it's just insane, because Arizona specifically, we were already kind of at the top for having those issues, and now it's continually getting a little bit worse. I don't know if you guys have had a chance to check it out, but the CDC has been asking weekly people from each state, if they're feeling new feelings of anxiety or depression. And they posted these data numbers, and continuously Arizona is in that like top 5 region of people more and more are feeling these feelings of anxiety or depression. So it's just insane to me that we aren't paying closer attention to it.
Mm-hmm.
Well, you're also seeing, Faith, you probably saw this too, you're seeing that we rank not very well also in terms of economic recovery, and obviously job losses, risk in terms of going to work. I mean, there's the whole list is really pretty tragic here in Arizona, and mental health ends up right in the in the thick of that. And all of this, I was thinking about the comment you made. When we look at over the last 20 years at what we've done, for example, we funded years ago research at the University of Arizona, where they were looking at the connectivity between cancer and mental health. And what they found is that if they work with the entire family and they address the issues of mental health of the patient who has cancer, that patient does far better. And now that has been taken to heart by MD Anderson and Memorial Sloan Kettering. And so what you see with treatment of cancer is a lot more focus on mental health. Now take what Athena said a few minutes ago, where she said you have all these people that have, conditions. All of those people, if you're addressing those conditions, but you're not addressing the mental health around those, what are we doing? We're going to have the same outcomes that we had before. So there's a big part, at least for me, that says we need to get much smarter about this. We need to fund mental health research because it's at the core of what we are as human beings.
And, we also know that mental health and mental well-being has a huge impact on our physical health. So, we can't kind of ignore that by supporting mental health, you actually make it easier for people to fight off infections and,
Right.
deal with other vulnerabilities that they might have because their bodies are just working better and their, immune systems are more finely tuned because they're not getting overactivated by all the cortisol all the time. Right. So there's, I think, there's an important, aspect of this, which is that, mental health and physical health, they're not these separate entities. They're kind of treated that way from a research perspective, in terms of funding often, but they're extremely entwined. And the more that we learn about the way the immune system works and the sort of neuroendocrine influences, so how, activation of the brain and the hormone system, how that influences physical and mental health, it's just astounding that, we're not kind of taking this more holistic approach in general, and that it's, really being treated like, oh, physical health research, let's spend so much money on that. Mental health research, it's almost like a kind of the old dualism, like there's mind and body, and we take body seriously and mind is just something on the surface that isn't really interacting with body. But the research now shows it's not the case. There really is a hugely important interplay between mental well-being, especially stress, and even just how your immune system works.
Totally. I mean, even as a student, when I'm super stressed out, it's harder to focus. And I don't understand how people don't think mental health and physical health go hand in hand. Why do you think that is? Why do you think people treat this as two separate problems when really they're interconnected?
Well, I can say that I think that one of the real issues about why mental health doesn't get the attention it should is it's still stigmatized, right? People are afraid of mental problems, right? They think that that's something internally flawed about those people that have mental illnesses, right? So I think that, in many ways, it's that there's still a stigma attached to this. We haven't gotten over it, right? It's why, we used to have huge institutions where we would house people with significant mental health problems, right? Well, those institutions all got eliminated, and this is why there's such a gigantic homeless population now, right? Is really the result of that deinstitutionalization, right? And those people out on the street, right? People get reinforced for their ideas about stereotypic ideas about mental illness in a lot of ways by seeing people out on the street, right? So that's one of the big issues. The other issues is just in terms of how much money we devote to mental health work as opposed to, medical kinds of research, right? The National Institutes of Health devotes 95% of their funding to biomedical research and less than 5% of funding to mental health research, right? So the reasons why we know so little about it, right, continues to be that it's underfunded things, right? We don't attend to it in the way that we really need to be attending to it, and that we need to fund it at much more significant levels than we have.
Do you think with this research coming out and the public having access to the research that you guys are funding, do you think the community and society will take it more seriously?
Well, I think that's exactly the reason to do this work. It's exactly the reason for us to talk to you about it, Faith, okay, right? And for you to take this message out, right? And to share it with people, right? You guys have an audience, right, that is very difficult for us to get as, scientists and people working at the level of nonprofit organizations, right? The media exposure that we can get that brings this message home to people winds up being super critical for us to then be able to generate the kind of money from donors that's going to help us do what we're trying to do, as well as get that message out to people why this is so important.
And Faith, by the way, in terms of donors, we don't care whether it's a $50 donor or, or a $25,000 donor. We are happy with, as you can imagine, any donations from anywhere. And I think Keith's point, we've seen this now for the last 10 years, just like you see it with the public health system. The mental health system has been, chronically underfunded in terms of research. So, and as long as that continues, people shouldn't ask the question of, well, how are things going to get better?
From another perspective, it's a wonderful way to empower folks to actually do something. I think it's such a huge issue, even if people aren't talking about it. I do think that it's slowly being destigmatized because of the increased awareness and the number of public figures that have come out to be more outspoken. But again, it's a very unique way of moving the ball forward that people can engage in and contribute and participate in. And so that's really the message that we want to bring out, is that you can be a part of the solution.
Yeah, and I think there's a really unique opportunity right now with the COVID pandemic, because I think people are becoming more aware of just how important mental health is. The challenges of, changing work situations, familial situations, obviously socializing with friends is nothing like what it used to be. And so people, I think, are realizing just how close to home mental health issues can be, for themselves, for their families, because of these changing circumstances. And my understanding is that, there's some populations where there's actually been kind of better awareness, like with, I think women who have been pregnant during COVID have actually been receiving more mental health attention than before. And so, I think there's some pockets where there's greater awareness and maybe more action happening. And by, looking in this time now, this time of COVID, there's, I think, some unique opportunities to really study mental health and study interventions in mental health and what their impacts might be. And now I'm just speculating, but I'm fascinated. I have a graduate student who works on maternal fetal health. And so we've been trying to follow what's been going on with pregnancy. And there's both been, this increase in mental health treatment and attention. And there's also been a dramatic decrease, it seems, in premature births. Now, whether those are connected, we don't know, right? You don't know whether there's a connection there, but those are two changes that have happened since the beginning of COVID. So, I think the kind of research that IMHR is in a position to fund, could actually take advantage of this really unique opportunity that is this moment with COVID, where there's both more vulnerability, but also I think a greater receptivity that a lot of people have to considering just how important mental health is for supporting our overall health and well-being as a society.
Definitely. And this is just a general question for anyone or everyone to answer, but kind of in a short answer, why is mental health especially important during this COVID-19 time? Why now?
Well, I think that COVID-19 has really shined a light on what was already there, but has really just exacerbated, and put people in just very intense situations, whether it's the trauma of, being overworked and or losing your job or whatever that is, to the social isolation, and also, again, some of the devastating effects that we really don't even understand yet about the virus on the neurological system. And so I think that, when you have that kind of light shined on it, that you can't look away from that light, right? And it's an opportunity for us to really deal with it. And and people really deal with things more acutely in a crisis, right? So that perhaps that will move the needle.
Thank you. Anyone else want to kind of tackle that
Well,
question?
I would just say that I think that, look, what's sort of endemic to this situation is the idea that it's a more stressful time in every way for almost every person. And there's probably no greater connection to mental health issues than the presence of stress. Okay? So under stress, what happens, right? We know is most of the theory around the emergence of mental illnesses, right, have to do with some stressor being present that exceeds the ability of that person to deal with or to cope with, right? And that's what leads to problems like anxiety, depression, and the more major mental health problems, right? So in that sense, that why COVID is so important is that it's creating stressors that are unique for individuals and for families, right? For kids, for adults, it doesn't matter, right? There are these unique stressors, and how those stressors need to be managed, right, is critical to well-being and mental health, right? So I think it's the stress unique to COVID that really sets the mental health issue apart.
I agree.
Yeah, the other thing, if you want to end on an up note, and there isn't much good to say about COVID, but if you go back to the time of the last pandemic, what is lovingly referred to 100 years ago as the Spanish flu, and you look at what happened after that, and in the 10 years after that, if you look at the breakthroughs in medical research, they're stunning. So, I mean, everything from vaccines, polio, to to the discovery of insulin. So there's no reason, if we're smart and we fund mental health research now, that we can't have that same kind of result over the next 5 to 10 years. So part of it is what's the short term that can be accomplished, but then there's also the issue of what's the long term. And the research results 100 years ago after the Spanish flu were just stunning in terms of what people did, what they discovered, in part because of the flu, what led people, because of the fear, to try to find solutions. And that's happening today also. And so hopefully, if people fund more of the work of scientists like Athena, we will get some kind of the same result, that 10 years from now, we'll look back and we'll say, COVID was terrible, but look at all these breakthroughs that have made us better as a people, better as a society.
That's interesting, and that's definitely a positive note. I haven't thought of it like that, or thought about the Spanish flu and those results. So that's super interesting. Thank you for sharing.
Sure.
Yeah, there might also be, just a greater ability of people to take others' perspective right now, because many more people are experiencing challenges than before the pandemic started. So, if that puts people in a better position to, consider the challenges that other people are having with mental health, then that might also make this a good moment for really digging deep in that research.
Definitely. Well, we are nearing the end of the interview. Is there any final thoughts or last things you guys want to say? The floor is all yours. Or if not.
I just want to remind, and again, Angel will give you the details about our webinars that again are free, and we hope that people will join us and profit off of the, or benefit off the research that are being done by these scientists in their day-to-day life. And also, if they want to support IMHR, we have a number of ways, certainly donations, as well as sponsorships. We have some committees that people can volunteer, and we just encourage everyone to come to imhr.org to find that out, because it's really going to take all of us to move this needle forward.
And Faith, we're also looking for board members, and they can be of any age. So if you have free time, let us know, because we, seriously, part of this is to get people's perspective from across the spectrum, and that includes across the age spectrum. No, I really appreciate this. You've asked great questions. I hope we've answered everything that you had that you wanted to ask us.
Yes, definitely. You all were very helpful, and you brought different perspectives for me as a listener that I hadn't thought of before. So thank you for bringing that to me. But it was amazing meeting all of you. Thank you so much for taking time out of your day to do this. I know everyone's super busy and has their busy, different schedule going on in the world right now, but thank you for making time.
Faith, I have
It's very
a
important.
question.
Okay, bye.
Bye-bye. Well, I just, go, Athena, go ahead, because I have a quick question as
Oh,
well.
yeah, I just wanted to ask, I know that in some of the emails you mentioned wanting to get some footage, but we're kind of at a challenging time now with that because ASU is actually shut down for any research that doesn't absolutely have to be in person. And because a lot of our work is happening online and we're having our, project meetings online, we don't actually have like a lab where we're all coming together and talking. So I don't know, how that shapes like what you want to do with the piece. I mean, I could certainly check with a few of my colleagues who are leading this project with me about like having a Zoom meeting where we're talking about the project, if that's something that would be of interest and you could, take a video of that, or we could, talk about the data and kind of do like a mock lab meeting almost where we're talking about what we're seeing and you could take some video of that. I'm happy to work with you about that. I just, we're just not in person right now because of the constraints. So.
Yes, definitely. I will connect with you individually.
Okay.
Some things that we have some of our interviewees do sometimes is actually take video off of their iPhone, what they're doing, kind of showing their daily life if you're interested in that.
Sure.
But I will connect with you and see what we can do and get creative with this because I know everyone is doing the same thing at home right now.
Yeah, great.
And how is this going to be a piece that will be broadcast, or how are you going to use this information?
Yeah, so this will be a story that I'm putting together, a broadcast story that will hopefully air in our show on Cronkite News on Arizona PBS. If it doesn't air in there, it will be on our website on Cronkite News, arizonapbs.org. It'll be both a digital written piece and a broadcast story as well.
Okay, great. Well, if you have any follow-up questions, please reach out.
I definitely will. And I don't know if Angel is still on this call, but thank you so much for connecting me with everyone.
I'm here. I thought this was a very successful interview. So I'm here. If you need any follow-up, please just let me know and I can connect you further with Athena if needed. And we can talk about the visual piece.
Perfect. Thank you so much.
And Faith, you'll let us know
Yes.
when it runs, right?
Yes, I'll let you guys know all the information. I will follow up when this gets pieced together. I'm still getting other pieces and other perspectives as well. So I will let you know when it turns out.
Thank you. All right.
That's
Stay
great.
safe.
Thanks so much. Take care.
Stay safe. Have an
Bye-bye.
amazing day.
Thanks, everyone.
Thank you.
Bye.
Bye-bye.